Okay, so here's that ultrasound equation that I was talking about. You can hit this link and you can go on. There's a nice little slideshow that talks about how to do this equation. But I'm just going to basically summarize it here for you. Basically, if lower the intensity you want a heating effect, you need to increase the time. So, and vice versa, if you have a higher intensity, you might want less time to achieve your heating effect. So remember we talked about 1 megahertz heats at about 0.2 degrees Celsius per minute per watts per centimeter squared. That's a mouthful, huh? And the 3 megahertz, remember it heats 3 times as fast, so it's at 0.6 degrees per Celsius per minute per watts per centimeter squared. So an example would be if you're using 1 megahertz at 1.5 watts per centimeter squared, which is a pretty typical setting, you get 0.2 degrees of Celsius times 1.5 watts per centimeter squared equals 0.3. So if you want 4 degrees Celsius to get that tissue extensibility going on, then we need 4 degrees Celsius. You can divide it by that formula 0.3, so that means you're going to need 13 minutes to get that effect that you're wanting. And so you're just going to plug in based on, so if this you were only able to go to 1.0, you realize that it's going to change this, and then this is going to increase the amount of time that you need to go to get that effect. And then another example would be using that more superficial frequency of 3 megahertz, and let's say you're setting it at that 0.8 watts per centimeter squared, which is the pretty average parameters for that. You have that 0.6 degrees Celsius times that 8 watts, 0.8 watts per centimeter squared, you're going to get 0.48, so then you're going to divide that into 4 degrees, and it would take you a little over 8 minutes. Which is pretty normal. I think we kind of tend to do that. So you would realize if you were going to go less than 0.8, you would have to probably increase this time, right? But if this was up at 1, then you probably wouldn't need that 8.3, you'd need a little bit less. So there's some good examples in here if you want to solidify that a little bit more in your head, so that when you're out in the clinic, you're actually therapeutically using this correctly and using the correct parameters. So we talked about that you don't want to go more than 2 times that ERA, and that's it would just take you way too long. You're going to move that sound head in overlapping circular or longitudinal patterns, and it talks about it about 4 centimeters per second. There is that study I was talking about from JOSPT in 2006 that we'll talk to you a little bit about. The study they did didn't really validate that it mattered whether you went slow or fast with your sound head. I tend to go slower because I tend to also like to have the benefit of it kind of like a soft tissue mobilization while I'm doing the ultrasound, so I tend to do it at a little slower rate. But if you're concerned about over a superficial area where there's some bone, you're obviously going to want to keep that sound head moving a little bit faster. So here we talk about the documentation, and in your book there's some really good samples of that as well. You're going to talk about the area treated, so like say the left lateral epicondyle area, the ultrasound frequency, so is that going to be a 1 megahertz versus a 3 megahertz? Your ultrasound intensity, those are those watts per centimeter squared, so that's either anywhere from that 0.5 up to 1.5 to 2 watts per centimeter squared. Your duty cycle, remember that's either continuous or pulse, so continuous could be the 100%. Pulse, you want to say, is it a 20% duty cycle or is it that 50% duty cycle? What are you doing? And there's even a 10% duty cycle on some of the machines. You want to know the size of the transducer, and again, there's a little sticker on there and that'll tell you what it is. You want the treatment duration. You want to know whether the ultrasound was delivered underwater, their response to intervention. We always want to do that under our SOAP nut to know whether it was something that was beneficial for them. Of course, with all of these, you're always going to check the skin, and then describe if different than the standard procedure that somebody would normally use. Okay, so here's just an example of those. And then I would encourage you to go look at the case scenarios in your Cameron book. For each one of these, they kind of give you samples of the different settings. So in your head, you should be thinking acute inflammation. You probably should be thinking of the duty cycle, that you're probably going to want to go pulse. Chronic, you're going to want to go probably more in the continuous. Scar tissue, depending on how acute it is. Same with the tendinosis. Joint contractures are probably definitely going to be doing more of a continuous cycle. So start thinking about that, and whether it's a superficial tissue versus a deep tissue as far as wanting to know what frequency to use. Okay, that's it. Thank you very much.